process or learning outcomes, then your sickness psychology should be converted into a wellness psychology. So shape our perception of illness and hinder the healing process. Even you are treated, but if you are mentally upset, your healing process will not be fast. You will have 2 days more in the hospital or under medical care. But if you are fit mentally, if your sick psychology is non-sick psychology, wellness psychology, well-being psychology, your immunity will be improved and your outcome of the disease will be positive. Look into that, what is positive, what is negative, and let us focus. Second is reframing your perspective, your long view, not short view. So frame in a beautiful way. Do you know that what is the importance of the frame? These things are same, picture is same, but this is just a cover of packing. So please pack your difficulties, pack your good things always in a better mind frame. And then is the social support, which is basically a community networks, how helping is, suppose the AG ambulance services, now the Salami and some other philanthropists, they are doing a good work. Even we have certain free hospitals, so on and so forth. And this is a very important, your community is depressed, your mindfulness and healing process is slow, and even you are emotionally unstable, anger, agitation, unsatisfaction, and even crying, shouting. These behaviors you will find if there is some sickness or kind of disturbed psychology. And then these are important, but I will touch this because we are at the university level. Cognitive or learning ability of sick people is less as compared to the healthy people. So healthy mind resides in a healthy body and healthy environment. And so more people, more stress, more sickness. So as the stress will increase, the sickness will increase. And the same thing is development of physical symptoms if you are showing some emotional symptoms. So emotional symptoms can be converted into physical symptoms, even peptic ulcer. If you find the more emotional people, they will have more stomach upsets or some kind of the disease. Please. Coping strategy is important. How you deal with the situation. Coping means dealing with the situation. Situation can be extraordinary situation. Situation can be of the life and death situation. Situation can be hospital versus home situation, or situation can be between the care and your illness. Suppose the response of the caregiver is not as you are feeling, then even this is a problem, particularly in surgical cases and in diagnostic cases. When you are being screened, your test is in the laboratory, you are waiting for that, whether it is a biopsy or it is a hepatitis B or C test, your anxiety, your stress will be increased. You have to cope with the situation. And one of the example is the Titanic sinking in the sea. Do you know the Titanic ship? So the people were just knowing that death is very close, or death is before their eyes, ship is going into the water, and how to cope this. And there are good examples still that some people remained calm, embraced the difficulty, and up to the last they felt comfortable that this was from the nature and if we can survive or not survive eventually. इसमें ये न्यूट्रिशन और न्यूट्रिएंट को मैंने समझा दिया आपको, और मेंटल हार्मनी और फिजिकल हार्मनी दोनों में आपको खुश रहना है। मेरा एक फार्मर था, उसको हम जब खाना देते थे तो वो पहले सालन खा लेता था और फिर रोटी खाता था। तो हम पूछते थे कि भाई आप क्या कर रहे हैं? कहते हैं साहब पेट ही भरना है, पहले खाएं या आगे खाएं, इससे क्या फ़र्क पड़ेगा, जो पेट में चली जाती है वो चीज़ें। ही वॉज सो कंटेंट विच इज़ वर्क एंड लाइफ। इमोशनल सपोर्ट, अब इमोशनल सपोर्ट के लिए आपको क्या क्या चाहिए? फैमिली चाहिए आपको, जो नेबरहुड हो वो भी लड़ने वाला नेबरहुड नहीं, कच्चे वाले इलाके वाला नेबरहुड ना हो कि जहाँ फायरिंग चल रही है। यू रिक्वायर अ सीरिंग, अ पीसफुल एटमॉस्फेयर, और इसको आजकल ब्लू जोन हेल्थ कहा जा रहा है। क्या कहा जा रहा है? कि ऊपर आसमान हो, खुले मैदान हो, लोग हों, कोई रुकावट नहीं हो, आप चले जा रहे हैं फिर वापस आ रहे हो, ठीक है। सो ब्लू जोन हेल्थ, प्लीज़ आप ये सवाल ज़रूर लिखना कि व्हाट इज ब्लू जोन हेल्थ, ठीक है। और ये अभी काफ़ी कोई 9 ऐसे इलाके दुनिया में हैं जिनको डिक्लेयर किया गया है ब्लू जोन हेल्थ, और वहाँ लोग जो है 100+ से ज़्यादा उम्र रहते हैं। ऑल पीपल आर बिटवीन 19 and 10। कोई वहाँ इतनी बड़ी हॉस्पिटल्स नहीं है, कोई बड़े वहाँ डॉक्टर नहीं है, बट इट इज़ ओपन एंड वास्ट। आगे चलें। आज मैं एक रिसर्च पढ़ा था, जस्ट फूड फॉर थॉट, कि एक रिसर्च की है उन्होंने डायबिटीज़, और जो दर्जी मशीन हाथ से चला रहे हैं और 2 दर्जी मशीन पैरों से चला रहे हैं, द डायबिटीज़ वाज लो in those who were using the foot or the legs as compared to the hands, because their body was using more energy। और आपको पता है कि वो दर्जी सारा दिन उसको ऐसे ऐसे करना पड़ता है। तो ये आपको हम रिसर्च क्वेश्चन देंगे, और आपके पास अगर कोई दर्जी आपको मिले, कम से कम 5 दर्जियों से पूछना जो हाथ वाली मशीन चलाते हैं, और 5 ऐसे जो अभी तक पुराने तरीके से चलाते हैं। व्हाट इज द लेवल ऑफ डायबिटीज, इसमें कम है, इसमें ज़्यादा है, ठीक है। एक्सरसाइज एंड बैलेंस डाइट। व्हेन आई से एक्सरसाइज, इट इज़ नॉट नेसेसरी यू शुड गो कॉस्टली जिम्स एंड कॉस्टली थिंग्स, बट यू कैन हैव सिंपल टूल्स and simple way of the exercise. Even physical activity, suppose you have attended this class, you are going through the stairs rather than the what we call lift, then these simple layers can also be better. Next please. So we are just closing that if you are emotionally unstable, which Pakistani population is, our students are, and even if something happens, then we become very much emotional. Then you can see ultimately neurological effect, your chemistry will be affected, you will have more cortisol, but that is a illness or sickness causing hormone. It will be released more, and same as your immune system will be depressed, and cardiovascular, palpitation, digestive, everything will be affected. Next. And look to this picture. Is it a healthy picture or sick picture? It is a healthy picture or sick picture?
Sick.
It represents a happy moment, bad moment, highly agitated mood. So, how to cope with these situations, the social support, even your networks, and even reading books, going to the libraries, changing your living in the present. If you will keep this picture in mind always when you are in the home, yes, okay, here it is okay, but after this picture is no more, it has gone. Inflammatory diseases, psychological diseases, and physical diseases all are part of our, and even the definition of the health is a state of complete physical, mental, and social well-being. And when I say social, then it is completely a psychological issue where you fit in the social spectrum of the life. Whether you are in the lower middle class, you are in the middle class, you are in the upper class, you will have a different feelings and different approaches, different excesses. Next important topic of psychology, sickness, health, and even the well-being. Well-being is a broader term in which even your economic well-being, your social well-being, and even political well-being is important. So well-being is another important concept. Normally the medical science is divided into wellness and illness. So you will have two paths, or rather a dichotomy, or two paths. Either you are moving on the wellness path or you are moving on the illness path. So wellness is when body, mind, and even the environment are in harmony, are balance, are in a positive level, or positive mode, or positive situation. Sickness itself is creating low quality of life. When you say I am sick, your quality of life is low. And when you say I am happy, your quality of life is better, or your quality of life is improved. And you can see that connection between mental state, physical well-being, and mind influences the onset, progression, recovery, as well as how you are dealing with the disease process is connected with the mind processes. It is not only the observed things, but something is going on at the physiological level, at a psychological level.